My name is Alexander Cernat. I'm the session organizer, so I represent the Social Statistics Committee at the RSS. And it's my pleasure to present two sessions today, one in the morning and one in the afternoon, discussing extensions to surveys. And we're going to look at exciting things like admin data and digital trace data, data linkage, social media data, and so on. So I think we're going to have very interesting presentations. And this is also live streamed, so for those of you online that have questions, you can put them in the chat. So how we'll go about it is each presentation will be 15 minutes. We'll have 5 minutes of questions immediately after, and then we'll do 4 presentations until the break. Okay, so there won't be a panel discussion at the end, just 5 minutes after each presentation. And the first presentation is from Bella Struminskaya. I'm still, after so many years, still butchering your name. From Utrecht University. So Bella, the floor is yours.
Thanks. Hi everyone. As Alex said, I am from Utrecht University. Pleased to be here, and this is my work together with colleagues from Statistics Netherlands, and I'm going to tell you about the effects of personalized feedback and recruitment using interviews in an app-based household budget survey. So what is the problem? The problem is that the traditional diary studies are quite burdensome, and respondents do not like to fill them in, so they suffer from low response rates. And this is not just evident in the Netherlands, where I'm from, but also from other countries. So, for example, the mean response rate for a household budget survey in the European Union was about 50%, and in the Netherlands only 17%. So this is of course problematic, not just a non-response per se, but non-response bias. And how to prevent it? There are some ways to collect data innovatively, which can help with preventing high survey fatigue and high dropout. And also prevent recall bias, because if people do some activities like spend money or use their time in some way for expenditures or for time use surveys, and then they postpone until filling it in the evening, then we can expect greater recall bias as more time passes. So what are the advantages of smartphones that help mitigate these problems? Well, they allow measurements in situ, so measurement in the real time, which can lower recall bias and also can lower the respondent burden. But there are some issues. So there are issues with coverage. Not everybody has a smartphone. And there are issues with privacy concerns. So people have more concerns when they're collecting data using new technologies rather than when they're filling in online surveys or paper surveys. Also, smartphone skills are problematic. So how do we ensure representativeness? Well, there are multiple ways to do that, and one of these ways is incentives, so paying respondents, and there have been studies which show that promising incentives increased willingness to participate and also increased app download. There's also feedback, so promising feedback to respondents increased willingness to participate in sensor and app-based studies, and also found here by Alexander Wenz, that the positive feedback or feedback increased positive reactions, but actually did not increase participation. So there are some open questions there. And the third one is using interviewers for recruiting. So interviewers might not be great for measuring these things, but for recruiting they can persuade people, motivate them. And a study by Annette Jekle found that if using recruitment face-to-face with interviews increased participation, but actually not necessarily increased representation. So basically, there were more of the same people, not bringing in different groups. So I will focus on these two aspects, providing feedback and interviewer-administered recruitment. We did a randomized experiment, or actually several of those, in an app-based household budget study and budget survey. And one was using interviewers for recruitment versus sending people mailed invitations. And the second one was to provide people with immediate feedback about their spending. So informing them that they will be able to see the insights versus providing delayed feedback. So not informing people and providing this after the study has ended. We also had an experiment on feedback of automated extraction from receipts, but I'm not going to focus on this one today. So the database for this presentation is the app-based household budget survey app, which was fielded in 2021 across 3 countries. So it was the Netherlands, Luxembourg, and Spain. And in Spain, only mail recruitment was used, so no interviewers. The incentives varied between countries. So Netherlands provided €5 prepaid incentives and 20 euros conditional on filling in the diaries. And then Luxembourg had the incentive between 25 and 65 euros conditional by household size. So if they didn't register, they were sent a postal reminder, and app could be installed by multiple people on multiple devices. The data collection was 14 days, so 2 weeks in the Netherlands and Luxembourg, and 7 days in Spain. And participants could take photos of receipts of their purchases, or they could also enter this manually. So you can see on the screen the manual entry of some of the purchases that I made for demonstration purposes. And we also collected pair data about in-app activities. So what are the outcomes that I'm looking at? Registration rates when they completed the entry questionnaire, in-app activities, if people reported at least 1 purchase, dropout, so last activity before the study has ended. Representativeness, we compared to the population registry, which is available in the Netherlands, and also data quality, where we compared the app-based version to the web-based version of the 2020 household budget survey. So there are a number of things we are looking at. I'm not going to read them all out, but just an important point is that we also corrected for household size, for example, and also looked at average number of products per country, because this could vary, so we accounted for this. So now, the exciting part, the results. What did we see? So here are the registration rates combined over 3 countries and for the 2020 household budget survey web administered. So we see that the overall completion rate is about 16%, so it's similar to the web-based household budget survey, and it varies somewhat across the countries. So the Netherlands somewhat lower, 14%, Luxembourg somewhat higher, 18%, but in essence, this is not worse, at least, than it was in the traditional version. So also we see that about 80% of those who completed the first questionnaire were registered, and about 83 stayed active within the app-based survey. So now, how representative is the web-based, the app-based version? Here we're looking at R indicators, so basically the variation of response propensities, and given the variables that are available from the registry. So these variables are different, so the combined R indicator and coefficient of variation are based on age, house, and household size, because only these were available in all 3 countries. But then you can see that in the Netherlands there was also education, urbanicity, home ownership, income, and so forth. So here what it would tell us is if R indicator is close to 1, we have highest representativeness, or if coefficient of variation is close to 0, we have highest representativeness. And we can see here, I would not compare across countries, right, because they're based on different variables, but I would look within the row. So we see that the registered, active, and complete, so the R indicator does not decrease along these steps, so this is a good message. So we do not see that we are losing representativeness across this stages in either country. So actually, it increases somewhat. And the R indicator for the HBS web-based version was 0.94, so also pretty close to the app-based version. Now, what about the recruitment strategy? Did it work to employ interviewers? Yes, it did. If you look at the registration rate, then the interviewers produced about twice as high rate as the male-based recruitment. And also for people who stayed active, those who were recruited by interviewers stayed active more so than the those who were recruited by mail. But we also see that interviewers did not necessarily bring in the same people, bring in different groups of people than male version. So basically similar in representativeness, but better in recruiting people. What about providing feedback? So here we see that promising feedback had no effect on activity in the app or dropout. So basically, having this feature, although people who use apps regularly, we think, well, they expect to receive feedback, making it salient did not have an effect. And how this feedback looked like, so basically here one could see what proportion of their expenditures was spent on which categories. So now the next part, huge table about data quality. So I don't expect you to look at all of this. So what we looked at was several indicators. So we looked at entries, how many entries they made in the web-based survey and in the app, the range of their purchases, the standard deviation of this amount, the range of the products they bought, the standard deviation of this amount, and then also the store types. So we saw that there was no difference in the mean of entered purchases between the web-based version and the app version. There was somewhat lower amount, or the range amount in the app-based version. No differences in the range of products that were bought, and somewhat fewer store types for the app-based version. So what we actually thought we would find is that we would see more smaller purchases because this is in situ, this is close to buying, but we didn't really see this effect. So in summary, the representativeness of the app-based version was similar or not worse, we conclude, than the web-based household budget survey. The recruitment face-to-face did have a large effect on participation, and feedback did not have an effect on, or promised feedback did not have an effect on either activity, registration, or dropout. We found that for 4 out of 6 data quality indicators, there was no substantial difference between the app-based and web-based version. And also what I didn't present here, but we looked at, was that there was no significant relationships between the data quality indicators and mode of recruitment, and either there was no significant relationship between the data quality indicators or personalized insights. So, well, on the one hand, we could say this is the app performs not worse, which is good. But there are some limitations to this study because the design was not completely equal across countries. It is quite difficult to pull this off. And there were some differences between 2020 and 2021. For example, also COVID. So expenditures might have changed due to lockdowns in such countries. We couldn't do in-depth analysis, so separate analysis across countries, because we had small number of cases per country. And also, as you have seen, if we compare countries with each other, then there are actually not so many auxiliary variables that we could use from the registries. The more severe problem, in my opinion, is that we don't have a truth about expenditures, right? We can compare web-based and app-based, but we don't know what is the gold standard. So maybe a possibility would be data donation of bank statements, which can be helpful. And I think we have a presentation on data donation later today in this session. And what we are planning to do is to look into the effect of optical character recognition feedback on reporting. So whether people become better in reporting when they see that their receipts have not been read correctly, and then they take better pictures and so forth. And also, we did not in this particular study ask about the evaluation questions about how their experience was. So next we are focusing on that. With this, I think I'm within time. Thank you so much. If you have any questions, please don't hesitate to contact me or ask them now.
Okay, so any questions for Bella? Don't be shy. Yeah, Curtis?
Thanks, Bella. That was a really great presentation. Really clearly set out and interesting findings. One of the points you made at the start was that with the app-based data collection, you're expecting people to potentially complete their entries in situ, so as they were making purchases, for example. I was wondering, but then you didn't see too much difference in people's patterns of response. And I was wondering whether you had any information or evidence on whether that's actually the case. So having an app, do people actually enter their information in situ, or do they still go home and enter all their receipts at the end of the day, or enter all their information at the end of the day, or something else?
So great question, thanks. We do have Paradata, and I'm not sure, so one of our students, I'm not sure if he has looked into that, but it would be a great thing to look at. I know so I coded some of the receipts to just get the feel of how it is, and I've seen some of the pictures where you could see that the picture of the train, of the receipt for buying the train ticket was done at the train station, so you could definitely see that this is, the floor of the train station. So I think that it does have an effect. Maybe they're uploading the photos or entering purchases later on. But I think that in some cases, at least, it helps to have it in hand. But yeah, we need to focus on that.
Thank you. Other questions? I have one. I was wondering if you did any cost-benefit analysis. So you see this big jump in response rates with interviewers, but I imagine they're much more expensive, right, interviews. So if you have any thoughts about that.
So I don't think, I'm not sure whether, we don't have it published, that I know, maybe internal, but yeah, of course, this having interviews, especially in times of COVID, where interviewers would try to, come in, recruit, and not be able to. This is a question. Yeah.
And did you have bigger incentives for sales, or if you didn't have?
So the incentives did not vary by the mode. So this, that would be confounding. But the incentives were the same across these groups. Okay. But of course, if the interviewer is there, then maybe there's more chance that they actually, get the incentive rather than throwing away the mail. Although Statistics Netherlands is a trustworthy sponsor, so I know that other survey programs kind of envy this, logo and want to have it as well, because then people think, okay, this is important. I need to open that.
Yeah.
So yeah.
Cool. Okay. Any final questions, or are we ready to move to the next one? Not okay. Thank you, Bella.
Well, if you think of any, feel free to contact me.
Yeah. So up next we have Curtis Joseph from NatCen, who will talk about social media data.
Okay. Hi everyone. Thank you for the introduction. My name's Curtis Joseph. I'm a Research Director at the National Centre for Social Research. And today I'll be talking about some ongoing work that I've been conducting looking at linking survey data and Twitter data. Before I start, just some acknowledgements. A big part of this work that I'll be talking about today was funded by an ESRC research grant, which I'm undertaking with Luke, Tarek, and Matt, as well as various other researchers at our various institutions who have been contributing along the way. So, in this presentation, I'll start off by giving a bit of background, why we want to link social media and survey data. I'll then talk about some of our past work, establishing the feasibility of the approach, looking at ethics, consent rates, and the challenges of data sharing, and a couple of case studies that we've looked at substantively. I'll then talk about our current work, which is developing the approach, mostly under that ESRC grant I was talking about, think about improving our consent rates, our data sharing plans, some methodological work we've been doing, and then finally I'll talk a little bit about our future plans, thinking about scaling up and how we might expand our approach to other areas. So, to get us started, why do we want to link social media and survey data? So, the social sciences have seen an increasing interest in the use of social media data in research. Researchers may, for example, be attracted by the large sample sizes, the ability to reach rarer populations, the quantity and richness of data, and the speed and accessibility of data that platforms may offer. However, and as with any research methodology, the use of social media data has its challenges. For example, social media data aren't created for research purposes. People may not produce the content on the topic that the researcher is trying to look into, or key analysis variables may be missing. There are also concerns about the representativeness of data collected from social media. Are the social media users representative of the wider target population of interest? Are the data biased towards the most vocal? And how do you ensure that the sample only includes your target population, for example, adults in the UK, rather than just a sample of Russian bots? By linking the survey and social media data together, what we're aiming to do is enhance both and address some of these challenges. As with other forms of data linkage, survey data can benefit from additional data covering areas not included in the original questionnaire, perhaps because of their complexity, because they weren't a topic of interest at the time the questionnaire was fielded, or simply due to space limitations. And at the same time, social media data can benefit from the structure and direction of survey data. For example, if we are confident in the quality of our survey sample, we can be confident that our social media data are also from our target population. And indeed, if the relevant information is collected in the survey, we can then also begin to analyse how social media use varies between different groups of interest, such as different age groups, different income groups, different groups of voters. The linked data can also provide opportunity to improve our existing approaches in each area separately. Social media researchers can use a linked data set to help validate classification algorithms against the ground truth of survey data, while longitudinal survey researchers can use the data for between-wave measurement or non-response adjustments. So, with this in mind, and a little over 5 years ago, we embarked on establishing the feasibility of this approach. And like all good researchers, one of the places we started thinking about was ethics. For social scientists, social media data have been pretty disruptive to how we think about conducting research ethically. The greater distance between the researcher and the participant can make establishing and recording informed consent difficult, relying on the usually unread terms and conditions of social media platforms is probably a problematic approach to be taking. At the same time, the use of publicly available and searchable data undermines our use of anonymization as a process for minimizing the risk of harm. We therefore return to thinking about our basic ethical principles that undermine our approaches: voluntary participation, minimizing harm, and maximizing value, rather than more established mechanisms for achieving these, and thinking about how they come together holistically to produce an ethical approach to research. For us, the fact that we were looking to link survey data to people's social media data meant that we already had an opportunity to ask for consent and ensure voluntary participation. However, this in turn brings its own challenges. People can choose not to consent, reducing our sample sizes for analysis and potentially introducing bias. Also, how do we ensure that any consent given is informed, given the complexity of what we're asking people to agree to? Our initial tests in 2017 did find relatively low consents, between a quarter and a third of Twitter users consenting for their data to be linked. High enough for this to be feasible, but certainly something where there was room for improvement, which I'll come back to a little bit later. We also found different levels of non-consent by mode of interview and between different groups of people, which you can read more about in the paper that I've referenced here. The second practical and ethical challenge of linking survey and Twitter data is maintaining the security of that data. Twitter data in their raw form are identifiable. Anyone can go online on Google and search for some open text and find who said it. If we link that then back to survey data, that in turn makes those survey data identifiable. At the same time, anonymizing the raw Twitter data would undermine its value. We can't just blank out and edit the text, otherwise a lot of types of analysis won't work. And this presents a challenge and forced us to shift away from thinking about anonymization and instead implementing alternative procedures. So, for example, systematic processing, making sure that we were holding our Twitter data and our survey data separately until the point that linkage is required. Data reduction. So, since for any given research question, it is likely that not all of the survey and social media data are actually needed. So you can reduce the risk of identification and the risk of harm by reducing the actual information that you link together. So for example, by only linking the required survey variables, you reduce the amount of disclosure that would occur if a breach occurs. Or with the Twitter data, if you reduce the amount that's linked, the risk of identification is also reduced. Controlling access to only registered users, people who've had training, increases the barriers to someone accessing the data maliciously, and making sure that we delete the data at the end of the project once it's been archived will help reduce the risks of data being exposed. And we take these principles forward in how we conduct the research over the past few years. Just to give a case study, we conducted a small number of small-scale studies with the data we collected when testing the feasibility. It was a while ago now, but you may remember that in 2017, the general election saw a dramatic turnaround in Labour and Jeremy Corbyn's fortunes, moving from around 20 percentage points behind in the polls to eventually removing Theresa May's majority in Parliament. And the survey data at the time told us a fair amount about this. For example, we were able to pick out that those who didn't vote in 2015, those who were less concerned about immigration, and those who wanted to stay in the EU were a key part of this swing. But the social media provided more texture to that. We could identify patterns in what people were talking about, typically parties and politicians, not necessarily policies or more general electioneering. And by linking the data, we also were able to find that this discourse was more common amongst Labour supporters, but less common among non-voters. Those of you who use Twitter will perhaps not be surprised to hear that most of the tweets were not typically supportive of the Conservative Party, but among those who were supporting Labour, we found that they were typically anti-Conservative conversations rather than necessarily pro-Labour. But again, by linking this to the survey data, we found that was more common amongst what we might call the liberal elite, whereas those who we identified as younger liberal people were more likely to be pro-Labour in their discussions online. We've also conducted other studies a little more recently. So Tarek El-Baghal's work has demonstrated the methodological utility of linked data, finding that the amount of content people produce, so the number of tweets, is associated with people's characteristics. And this means that since Twitter's API often works on a sample of tweets, the fact that those who tweet more are likely to be selected, this introduces bias into the sample. Alex Venz's analysis also used linked data to explore Twitter use during the COVID-19 pandemic, demonstrating how having this data linkage in place allows us to respond more quickly to events as they occur, rather than waiting for a survey to be fielded and put into operation before we can get any data out there. So, with that feasibility established, we looked at how we could develop the approach, and our next section talks about some of the work that we're currently doing. Firstly, we engaged with some of the methodological challenges that we had in collecting informed consent. In 2021, we conducted a qualitative study to explore public attitudes to consenting to Twitter data linkage. Somewhat troublingly, we found that none of our participants were making fully informed decisions. Asking people to process so much information so quickly led to heuristic decision-making processes based on, for example, the perceived risks or their trust in us as an organisation asking for the consent. More reassuringly, once we then probed a little bit deeper, participants didn't change their mind in agreeing or disagreeing to the consent, but it raised interesting questions about researchers' responsibilities here. Do we attempt to enforce an informed decision, or do we respect respondents' agency in how they make the choice? The feedback from this has led to a redesign of the question, reducing the reading burden and highlighting key issues to maximise engagement, but making more detailed information available to those who need it. And this is something we're currently conducting an experiment with on Understanding Society Innovation Panel. In terms of data sharing, we've already managed to develop protocols that allow for secure sharing of data between organisations in a manner that maintains data utility. But our next step is thinking about how we can make some of the same data available to the wider research community, with the goal of producing two outputs. So firstly, a more openly accessible data set, which creates summary DVs, derived variables that are non-disclosive but still useful to researchers. And then a data set which retains more detailed and disclosive data, but developing processes that allow for its access by the wider community. The study also has two strands of methodological work, looking at how we can enhance Twitter data and analysis using survey data and vice versa. We know that existing tools that use users' profile and tweet information struggle to accurately predict people's characteristics. So the former of this work will be using the matched data to validate these tools, but also enhance them, acting as a validated training data set. The latter will do the reverse, using Twitter data to validate survey measures, but also look at what derived variables can be created from the Twitter data and appended to the survey data, linking in with all that data sharing work that we've just discussed. It will also explore the feasibility of using Twitter data to inform item and unit non-response adjustments. Finally, our current work includes what we call a demonstrator study to test the protocols that we're developing and the systems, but also as a real-world point of reference to see how these kinds of linked data can be utilised in practice. Starting next month, we'll be conducting a survey with a representative sample of 2,000 adults, boosted with a sample of around 4,000 Twitter users that will collect survey information, looking at people's attitudes to ethnic minority groups, and ask for consent to collect and link their Twitter data to that. Unlinked, these would provide two interesting perspectives on public attitudes in the UK. The survey using established measures to see how estimates have changed over time, and Twitter data allowing for analysis over a finer period, as well as tracking into the past and the future. The survey will use more standardised, targeted questions, while the Twitter data will complement that with more qualitative insights on how people are talking, and for ad hoc responses to measures to focus on specific events as they occur. But linked, these data will allow us to go further. Matching the survey demographics onto Twitter data will allow us to understand how different demographic groups talk differently on Twitter. While linking Twitter network information onto the survey data, we'll see how people's reported attitudes vary by who people are following and their sources of information and who they're interacting with on social media. And connected self-reported opinions and what they actually express on Twitter will allow us to see whether those views align or not, and for whom, and why they might differ. So, we've still got plenty to be getting on with, but where are we thinking about going next? There are still key methodological challenges. We'll see what the outcomes from our experimental work are, but we're always looking to push those consent rates higher and improve the quality of the data that we're using. Related to that, sample sizes remain a key challenge. Only a proportion of the population use Twitter, and a proportion of those will consent to data linkage, which will limit our statistical power. Should our work on publishing the Understanding Society Innovation Panel data be successful, we'll be looking to include this consent question on the main stage of Understanding Society, increasing our sample size from thousands of people to tens of thousands of people, and allowing us to greatly scale up the potential for work here. Finally, we're looking at how we can expand this methodology to other forms of data. We have already begun looking at the potential of LinkedIn data, drawing in people's education and employment history and skills, but we're also looking at how the approach can be expanded and adapted and applied to other forms of digital trace data. Here are some references, and thank you very much for your time.
Thank you so much. Any questions for Curtis? Yeah, please.
Thank you so much for the presentation. It was very interesting. I've got two questions that are kind of linked to each other. So when it comes to the analysis of the Twitter data, are you looking at Twitter retrospectively, or are you checking what the user, the participant, is tweeting as they participate into the study? Because I imagine that the second approach would produce some bias because they know they're being watched.
Yeah, that's a good question. So we ask both retrospective and prospective consent, and we'll need to consider that exact point when we're analysing the data. I think it's probably relatively unlikely, given how people use Twitter, that they'll necessarily be changing their behaviour based on the fact that they think research is doing that. If they were concerned about that, they probably wouldn't be consenting to the process in the first place, which of course raises the question, are people who are expressing certain types of views consenting, more or less likely to be consenting? So yes, absolutely, there's a risk of bias there.
Yeah, that makes sense. And the other question was, I imagine that, with 2,000 participants and, did you say 4,000 Twitter users?
Mm-hmm.
Like, that's an enormous amount of qualitative data because obviously it's tweets. And I'm just curious, how are you analyzing this data? Like, do you have like automated software? Are you doing it manually? How many people do you have to do it manually?
Yeah, so it won't be used doing it manually. So my colleagues are probably a little bit better informed than I am on how to do this, but yes, we will typically use different types of software. So some of my colleagues in Cardiff are based in a social media research lab, and they have a piece of software that is designed to analyse and structure social media data. It depends on the particular types of analysis that we're doing. So for example, if we were interested in people's networks and understanding who they follow, then a simple code frame of a list of all of the people they follow and saying this is a news organisation, this is a politician, etc., is relatively straightforward.
Yeah.
Whereas, for example, analysing the open text data is more difficult.
Yeah.
And, for example, accounting for all the stuff around, whether something's sarcastic or not, all that kind of stuff can be a little bit more difficult. So yeah, that's something that we need to use more artificial intelligence and machine learning in order to code properly.
Yeah, that's great. Thank you.
Thank you so much. Other questions? Yeah, Richard?
Thanks for a really interesting talk. So the consent rates that you saw in your pilot were quite low. Obviously, you suggested some things that you could do to try and improve the leakage consent rates. Do you have a kind of expected or target level of consent rate? And in particular, do you think you can get it close to the consent rates for other types of linkage, or do you think there's always going to be a gap?
Yeah. I wouldn't say that there's a target. I think we want to get it as high as possible. Is the simple answer to that. And given that we've tried this once and we need to build on the literature, obviously we were very aware of consent to link to administrative data when we were developing these questions, but the nature of it does feel very different. People seem to think about their Twitter data as something they put into the public and they own, and is potentially expressing an opinion, and they don't really know what is there. Whereas administrative data, they can really see a much closer link to the kind of survey research they're doing. It's being held by trusted organisations already, and appears to be a little bit less sensitive. I think those consent rates that you saw there were somewhat muted by the fact that it was an online consent question as well. So as you'll know, where you do ask for consent to link administrative records as well to survey data, those consent rates are much, much lower online than if you have an interviewer administering them, so that will have muted it somewhat. In terms of, I guess, optimism and thinking about how high we can get them, there have been reports of people asking for consent to link survey data and Twitter data that have gone as high as 80%. Now, those have been done in particular contexts with particular types of samples, non-probability online panels, and they've often been offered a small incentive for the purposes of doing that. And one of the experiments that we're going to be running over the next few months will be seeing whether offering a small incentive, just a couple of pounds, actually has an impact on whether or not people are willing to consent or not, and if so, how much. And also we'll be drawing a comparison between a non-probability online, commercial online panel and a probability recruited sample to see whether that's making much of a difference as well. So we're definitely getting more information, and that will hopefully help us to understand what's going on.
Okay, thank you so much. So I think the time is done.
Okay.
So Curtis will be around for more questions. So up next we have Richard Silverwood from UCL who will give us 2 presentations. One of his colleagues was missing in action, unfortunately. So Richard, the floor is yours.
Thank you. Great. Thank you for the introduction. So yeah, I'm Richard Silverwood. I'm from the Centre for Longitudinal Studies at UCL, and this is some work in collaboration with colleagues both at CLS and at the UCL Institute for Child Health. So the presentation that follows this, which is looking at using linked hospital episode statistics data to better handle non-response and restore sample representativeness in the National Child Development Study, was really the work that we'd intended to do. But we quickly realized that because we were some of the first people to be using this linked data resource, we needed to do a bit more work ourselves around assessing the quality of the linked data and thinking a bit more about the representativeness of the sample. And this is the work that I'm going to present here. So a brief background, some information on the data sources, so the NCDS, the HES, and how these have been linked. Then I'm just going to give a couple of examples from this, a broader area of work that we've been doing. The first, thinking about using internal survey information to try and get a handle on linked data quality. And the second, using external population data to think about the representativeness of the linked sample. So over recent years, there's been increases in linkages between surveys and administrative data. Primarily, the purpose here is to sort of enhance the surveys, so to bring in greater information for research purposes. But it's important to evaluate the quality of such linkages, in particular to discern the likely reliability of research undertaken using the linked data resource, and also to consider whether additional methods may need to be applied to overcome any potential bias. Linkages are generally undertaken only for survey participants who have given explicit consent. So in the context that we're looking at here, which is a longitudinal survey, there's some particular issues around this. So because we're following individuals up over time, there's been plenty of opportunity for them to drop out of the surveys prior to the point at which we ask for their consent for the linkage. So anyone who's dropped out, we can't ask them, they can't consent, we're not going to have their linked data, so there's a potential for selection bias. Even those who are still responding in the study at the point where we ask for their consent for linkage, some of them will obviously withhold that consent, so again, no linked data, potential for selection bias. And this is just in the setting of perfect linkage, which is obviously unlikely in practice. So often there will be linkage errors, so mismatches, false matches, so further possibility of bias there. So a few methods have been proposed in the literature for trying to assess sort of the quality of linked data. One which is using a gold standard data set to try and quantify linkage error, so where you have some information on the true linkage, the true matches. But in the situation that we're working in, where you've got a separation of processes for linkage and for analysis, this sort of approach isn't really feasible. So the question is really, in this setting, what are the best approaches for assessing linked data quality? So the data that we're using here, National Child Development Study, it's a longitudinal birth cohort study of all babies born in 1 week in 1958. Initially over 17,000 cohort members, augmented slightly with immigrants later on. They've been followed up on 11 occasions between birth and age 55. Recently there's been 3 waves of COVID-19 specific data collection, and we're currently out in the field collecting a conventional wave of information as well. So it's a really multidisciplinary study. content spanning a variety of different areas which have obviously changed in their nature over time as the individuals in the cohort have gone through their life stages. And it's been used over the decades for lots of important bits of research. So we've been linking a variety of different administrative data sources into all of our cohort studies, including NCDS. The one I'm focusing on today is hospital episode statistics. So this is a collection of databases containing details of interactions with NHS hospitals in England. It comes in 4 separate data sets: admitted patient care, critical care, accident, emergency, and outpatient. And in this talk, I'm really just going to be focusing on APC and the outpatients. At the moment, we probably don't need to worry too much about what's included in these data sets, because we're just thinking about whether or not we have linked data, but I'll come back to that in the subsequent talk. And the structure of this, so each episode corresponds to a patient's a single period of care under a single consultant within a single hospital provider. And a period of care from admission right through until you leave the hospital is referred to as a spell, and that could be made up of one or potentially many episodes of care. And the period of data availability does differ depending on the data set. So from 1997 onwards in APC is the earliest. So the linkage has been conducted on the basis of consent at sweep 8. The matching was, because there's not a single personal identifier across the data sources, it's a deterministic linkage based on combinations of the participant's name, sex, date of birth, and postcode. We've got linked data currently available from the start of data availability up until 2017, but these data will be periodically refreshed, so there's a refresh due soon. And these are available for analysis, for research purposes, through the UK Data Service. So if you're interested in using them, please do have a look into that. They are there. So this is a kind of data flow chart. Sorry for the small text size here. There's a bit going on, so maybe we can go through this in a little bit of detail. So the first thing to note is that there's something of a disconnect between the survey and HES. So NCDS covers all of Great Britain, whereas HES is just English hospitals. So first of all, we needed to define eligibility for linkage within NCDS, and we do this by requiring cohort members to have ever lived in England between age 42, wave 6, and age 55, wave 9, to align as closely as possible to HES data availability. We also require them to be in the wave 8 target population, as this is when we sought linkage consent. So if they weren't in the target population, they wouldn't be asked for their consent. Non-respondents at wave 8 over here, because this is when we're seeking consent. Obviously, if they didn't respond, they would have been unable to give their consent, so they're excluded. And amongst those who did respond, 79% of them did give consent to linkage. Again, those who don't give consent are excluded from the linkage. And amongst those who do give consent to the linkage, 93% of them successfully had linked data from one or more of the HES data sets. So there are a number here, 7% of the linkage consenters who have no linked HES data in any of these 4 HES data sets. And these individuals will likely be made up of a combination of individuals who truly had no HES records over this period, and therefore it's entirely appropriate they don't have any linked HES data, as well as potentially individuals where there was a linkage error, so there was a missed match, which means that they incorrectly get lumped into this group. And this is one of the questions, how best to handle these individuals that we've been trying to address in some of this work. Okay, so first of all, just a quick example of one of the approaches we've been using, trying to use internal data to assess linkage quality. So what we're doing here is we're looking within our survey data, trying to identify variables that are as closely aligned as possible to information that's captured within HES. So one example of this is in NCDS Wave 8, age 50, we've got a question asking, since the date of your last interview or the 1st of January 2000, whichever was later, have you been in a hospital or clinic as a day patient or inpatient overnight or longer? And so this clearly is fairly well aligned to having a record within HES admitted patient care. So what we do here, we look within the HES APC records, align as well as possible to the individual's period that will be covered by this question within NCDS, see whether they've got linked data, then cross-tabulate that with their reported, with their response to the survey question. We can do similar things for other variables that we observe in the survey data, so we can do something similar for outpatient attendance. Sorry. But then there's also a kind of second tier of survey variables that aren't perfectly aligned to the contents of HES, but which we think should be sufficiently associated to give us some additional contextual information. So, for example, comparing self-rated health to whether or not individuals have admitted patient care or outpatient linkage. And these are just some examples of analysis that we've done from a broader set of analyses. So just presenting one set of results for the example question that I gave there, we can see in the rows that of those who reported in the survey at age 50 that they had had day patient or inpatient attendance, 76% of those did have linked HES APC data, and of those who reported that they didn't in the survey data, 86% of them did not have HES APC data. So we can see that there's a reasonable level of agreement there, but it's not perfect. So what might be going on here? So you might immediately jump to the conclusion that the differences are due to linkage errors, so mismatches or false matches, which of course might be the case. But there could be other explanations too. So the scope of the HES data set and the survey questions, or more meaningfully, the cohort members' interpretation of the survey questions, may not be fully aligned. You can see that there's scope for that. These are, of course, self-reported survey data, so there may be kind of misrecollections and other causes of misclassification. And although I've tried to align the HES data as closely as possible to the period of the survey data, there may be some inconsistencies in the periods being considered. So given these considerations, we think the observed levels of correspondence are probably encouraging in this setting. So we've done that for a number of different variables. And moving on now, I'm thinking about how we can try and use external population data to think about the representativeness of the linked sample. So I've only got one example of this because we only found one way in which we could do this. So what we're considering here are finished admission episodes. So this is the first episode in a spell of care. So as I said before, spells can be made up of multiple episodes. So really it's a count of the number of admissions that individuals have had, so they could have more than one. So we calculate in both data sources, so our linked data source and in the whole population, the FAE rate per 1,000 individuals for each financial year. In this linked survey data, we can do this by just counting the FAEs that we observe and standardizing them by the number of cohort members contributing. In the whole population, we don't have access to whole population HES data, which would make our job a lot easier. So what we've done here is extracting the FAE counts in 5-year age bands and by financial year across multiple published reports, and then standardize them using ONS mid-year population estimates, which need a bit of work to get everything aligned. So they're in 5-year age bands corresponding to the current age of the cohort members. So the grey line here is the population data. The green, blue, and orange lines correspond to different denominator definitions, really, in the linked data. So the green one is kind of implausible, so we can ignore that. The truth, we think, is somewhere between the blue and the orange. And the orange line here, in the denominator, we're using all HES linkage consensus. So that essentially corresponds to all, to assuming that everyone who doesn't have a linked HES record truly didn't have a HES record. And we can see here that the population data isn't really well aligned, surprisingly well aligned, given all the potential for selection that's going on all over the place with what we observe in the cohort. So we were really heartened to observe this. So a few conclusions. Our findings suggest that the linkage quality of the NCDS HES data is high. I mean, high might be overstating a bit, but at least it's not terrible. And that the linked sample maintains an excellent level of population representativeness. And we hope that these analyses will both improve the quality and transparency of research using this linked data resource, including our own research, and encourage providers and users of other linked data resources to undertake and publish similarly thorough evaluations. A few references. The first is just to the data themselves, if you're interested in using them. The second is a user guide describing the data in more detail, the linkage in more detail. And the final one is a working paper covering the work I've presented here and a lot more besides. Thank you very much to the funders of the work, and thank you for listening.
So any questions? Yeah, Paulina? Yeah.
Yeah, thank you. Very interesting presentation. I was just wondering, with the way you assess the linkage quality, so with linkage error, you can have false positive and false negative linkage error, but would this assessment actually capture also false positive linkage error? So if you actually link two individuals that are not the same individual, so they are still representative, and you said that some of the records from one of the sources are incorrect, would that also be captured by this?
Yeah, so if there are kind of false matches, but the false matches still give the correct information with respect to this one individual variable, then yes, we wouldn't be able to tell that that was a false match here. I guess because we're doing these, certainly the first approach that I presented, we're doing that across multiple variables. So I guess maybe that would by aggregating or summarizing across those, maybe it would help to give us a bit more information on the potential for false matches in general. But no, I think it's tricky to try and distinguish between those different situations given the information that we have. So even though I'm at CLS and we kind of have ownership of this linked data resource, I'm approaching this as just a researcher who's accessing the linked data as a kind of finished product, and therefore I don't have access to some of the additional information that, if you were personally involved in the linkage, it might be able to help in distinguishing between some of these cases.
Thank you. Other questions? Yeah, please.
Thanks for a very interesting talk. I was just wondering, I'm in this sort of age group, although I'm pretty sure I'm not in your cohort. And I was wondering whether your measure of quality seems to rely on people's recollection of whether they had a hospital episode. And I was wondering whether the matching criteria, which one do you value higher? People's recollection accuracy or your matching criteria?
Yeah, and so I think that's a broader question about the kind of quality of these administrative data resources relative to the survey data as well. So not just about whether or not there's a linkage, but if you were to utilize some of the information from within HES and there's comparable information within the survey, which would you trust more? And so I think it rather depends on context. I think assuming that you've got an appropriate linkage, I think that the information in HES is objectively captured, and on that basis should be reliable insofar as it captures what it sets out to capture. But I mean, obviously these administrative data sets are not really developed for research purposes, and therefore it might not contain everything that you want. Whereas the survey data that we have is obviously designed for that purpose. We've captured the information that we want, and it's likely to be a lot richer. But I think that in terms of the kind of the accuracy of what it does contain, then you would expect the HES data to be potentially of greater quality, if that answers the question.
A question from me as well. I was wondering if you consider using things like latent class modeling to deal with this misclassification you might have both in the survey and the admin data.
Yeah, so how are you thinking to operationalize that?
Well, in the sense that you have questions that measure the same concept in
Yeah.
two different data sets. It could be multiple time points, and you can make like a measure model with some misclassification, and you can decide in what direction the misclassification might be, and so on.
Yeah, no, I think that sounds like a good idea, yeah, particularly as you say, if we've got multiple measures potentially longitudinally in the survey data tapping into the same construct, then you could set up a nice structural equation model, I suppose, and try and assess some of the measurement properties or relative measurement properties of the two. And that's some other work that we've been considering in, not directly that, but similar issues around measurement, been considering as part of this kind of broader grant that we have, looking at some methodological issues in the kind of linkage of survey and admin data. Thank you.
Cool. Thank you. So are you ready for the next one?
Yeah.
Okay. Thanks.
Thank you. So yes, my colleague Nazir was due to present this, but unfortunately he was unable to attend at the last minute, so I'm stepping in. I don't particularly enjoy presenting other people's slides, so please bear with me and we'll see how we go. So this is really, as I was saying in the previous talk, the work that we were trying to do before we got sucked into trying to assess data quality and representativeness a bit more. So because I've just presented about the data sources and I didn't see anyone new coming into the room, I can go very quickly over the information on the data. And then really, the central part of this talk is thinking about deriving variables from HES data, potentially quite a lot of them, then using a method to try and decide which ones of those are the most important predictors of subsequent non-response within the survey, so NCDS Wave 9. And then exploring how including those identified predictors of non-response within methods for dealing with non-response, for missing data, can potentially help us restore the sample representativeness of NCDS. So non-response is common in probably all surveys. It's a particular issue in longitudinal surveys where you may have some initial non-response, but then you've additionally got the possibility of attrition over time. And in the sort of long-running longitudinal survey that I'm thinking of, where we've got decades of follow-up, obviously there's plenty of potential for attrition over that period, although in NCDS the response rates have remained relatively high considering how long they've been running for. So when we've got missing values, missing data due to non-response, reduces the size of the analysis sample, so inefficient estimates. But I think more importantly, there's plenty of literature saying that there's likely to be systematic differences between your respondents and your non-respondents, and if you don't appropriately take that into account, there's the potential for possibly quite serious bias. So here I think I'll diverge a little bit from the slides and say a little bit about missing data mechanisms. There's now many different methods that are commonly used for handling missing data, such as multiple imputation, inverse probability weighting, full information, maximum likelihood. These methods all rely on an assumption of the data being missing at random, so that is conditional on your observed values. The probability of missingness doesn't additionally depend on your unobserved values. And all of these approaches, as I say, rely on that missing at random assumption to give you unbiased results. And so taking multiple imputation as the example, because we're going to come back and use that later. One way that you can do this, so when you're specifying your imputation model that's used to draw values for your imputed data sets, you can, as well as including all your analysis variables, the variables from your substantive model in your analysis model, there's the opportunity to specify auxiliary variables that aren't within your substantive model. And by doing this in a careful way, we can try and improve the maximize the plausibility of the missing at random assumption. And that's something that we've been trying to do and to promote in the CLS cohorts. And what we've been doing within each cohort is trying to utilize the rich information we've got on cohort members going back many years or decades. So we've been applying data-driven approaches to try and identify which variables from those often hundreds of variables going back through time are predictive of non-response, so wave-specific non-response, at certain waves. And then using those as auxiliary variables in principal methods for missing data handling to try and overcome the kind of the bias that's introduced through this more systematic non-response, so selection into response. And this work here is really extending that work to also try and identify variables from within linked administrative data sources that are associated with or predictive of non-response, and including those in similar sorts of methods. And so this is what we're going to do here. So I think I can skip this completely. We're using the same linkage, NCDS and HES, although last time I did skip over the information on what was included in the data sets, and that's important here. So within each of those, we have information on dates, diagnoses using ICD-10 codes, procedures using OPCS4 codes, basic patient demographics, basic hospital characteristics, and that's for each episode, which I say then form into spells within each individual. So this is similar to the data flow chart I presented previously, so the same inclusion criteria to be considered eligible for linkage, respondents at wave 8 to be able to consent to linkage. Here, because what we're looking to do is identify HES variables that are predictors of non-response at wave 9, we are restricting to those who are in the wave 9 target population. So that is still alive and living in the UK at wave 9, because otherwise it doesn't make sense to think about their response or not. So within that group, we've got any linked HES data up to 2017 on over 6,000 cohort members. But here, because we're looking at predictors of non-response at wave 9 in 2013, we want to restrict our attention to HES data prior to that point. So we're only interested in this HES data here. So it means that there's some individuals with linked HES data only in 2013 and later who we include here, but for the purpose of this analysis, we essentially consider as not having any linked HES data because of the time period. So as I say, the idea is to identify variables that we've derived from HES that are predictive of non-response in NCDS wave 9. So first of all, we're faced with these massive HES data sets, so we do a bit of work trying to derive some important variables. And we derived a total of 58 variables. We tried to derive everything that looked like it could potentially be useful, but excluded anything that would have a very small prevalence, as that would be a low prevalence, as it would be expected to not really be able to contribute very much information in the setting that we're interested in. So the variables that we've derived cover things such as numbers of admissions and appointments, missed appointments, and then lots of variables around the investigations undertaken, different diagnoses. So here we're using the kind of top-level ICD-10 chapters rather than individual diagnoses. As I say, we'll probably have quite low prevalences, and then treatments received on the basis of the codes. On the basis of the previous work, we assume that cohort members who were eligible for and consented to the linkage but don't have any linked HES data truly don't have a relevant interaction with an NHS hospital, and we code them with that in mind. So we take as an input to this our 58 derived HES variables. We use a lasso approach to try and go from this 58 and identify a subgroup of those that are the most important predictors of non-response. And by doing that, we end up with 10 variables that are deemed as more important predictors that we take forward to the next stage of the analysis. And those variables included the number of A&E appointments, treatment for adult mental health, proportion of appointments missed, and then 5 ICD-10 diagnoses based on ICD-10 chapters, and a couple of operations based on the codes that are in APC. So the idea is then that we include these identified predictors of non-response in as auxiliary variables in analyses that are of NCDS data that are subject to non-response, with the idea that they can help us to restore sample representativeness. And I'm going to show you, we've done this in lots of different analyses using kind of internal and external data again. I'm going to show you a couple of examples using the same variable, which is cognitive ability at age 7, that's observed within NCDS, but doing it in a couple of ways. So the first one is just considering our analytic sample being HES linkage consenters. So this is less likely to be the plausible analysis sample of interest. It only would be if you're using HES variables. But what it allows us to do is look at including only just those HES variables as auxiliary variables, as we'll see, and so we can see how much they're contributing to this in isolation. Whereas if we're analysing the whole cohort, then we can't do that because there's too many cohort members who would be missing on, or just not have any of those variables, and the model would collapse. So what we do is we take a variable that we've observed earlier on, a survey variable we've observed earlier on in NCDS, and then we pretend that we've only observed this for individuals who responded at wave 9. So we're kind of imposing some artificial missingness, and we can try then, we know what the kind of truth is, so we can go back, use different methods, and see how well we can do in overcoming this. So there's quite a bit to do here, so let's go through it again in a bit of detail. So the first estimate here is the mean cognitive ability at age 7 against for all respondents in NCDS, so over 14,000. The next is just those in the wave 9 target population. These first two results are really just for a bit of context. That's not what we're interested in here. The third result here is looking again just at the mean cognitive ability at age 7 amongst just those who consented to linkage to HES data. So the difference between this and the second estimate is the bias introduced by the consent or selective consent into the linkage. But this third one here is really the kind of target estimate that we're trying to get back to in the subsequent analyses. So number 4 is showing us the mean in wave 9 respondents. So the difference between this and number 3 is the bias introduced by selective response. And what we want to do is really overcome this using one of these methods and to come back to what we see in estimate 3. So the final ones are all looking at how multiple imputation can help us to restore this sample representativeness. So in each case, we're using chained equations with 20 imputed data sets. The first one of these, estimate 5, is using as its auxiliary variables just the identified HES predictors of non-response. And we can see, comparing that to estimate 4, that the point estimate has moved slightly towards that kind of target estimate in number 3, but it's not really moved that far, and actually the confidence interval width has increased a bit, so there's some loss in efficiency there. In number 6, we're using as the auxiliary variables instead a selection of about 20 survey variables that we've identified, as I suggested before, from previous work that we've done using data-driven methods to identify all previous survey variables predictive of non-response. And this does a great job. So comparing 6 to 4 and to 3, we can see that basically all the bias induced by the selective response has been overcome. In the final one, we include both the survey and the HES predictors of non-response as the auxiliary variables. There's not really much that the HES variables can add here because the survey variables have already done so well. The second analysis, the same thing, but here we're looking amongst all cohort members. So the first two estimates are the same, just amongst all cohort members and among the target population. But now, because we are in our analysis sample, we're using the whole cohort data. This is the target estimate that we want to come back to. In the third one here, we can see that in the whole sample, the bias introduced by selective response at wave 9 is substantial. But in our two MI analyses, we're able to overcome this entirely. But again, so here in this setting, we can't include just HES variables on their own as auxiliary variables because there would be too high a proportion of the sample where those are just completely missing, so it wouldn't work. But in the final one, we can see here that adding the HES variables in addition to the survey variables as auxiliary variables really isn't giving us much. There's no opportunity for it to give us any additional gain, essentially because the survey variables themselves are doing so well. So we've done this for a number of different variables, including with reference to external population benchmarks, and there are some cases where the survey variables don't perform quite so well. So there is some still potential additional gain from including the HES variables. But even there, we see that there's not really much additional gain from including those HES variables. So in this work, we've identified HES variables which were predictive of non-response at NCDS Wave 9. By incorporating these variables as auxiliary variables in multiple imputation analyses of NCDS data, it had relatively little impact on restoring sample representativeness, and essentially no additional gain compared to including just the previously identified survey predictors of non-response. And so, obviously, this is just one sweep of data collection in one study, so these results may not be further generalizable, but it does highlight the utility of the survey variables in handling non-response. And I think this is an important message for users because the survey variables are available immediately from the UK Data Service under a standard end-user license, whereas the linked HES data, you have to go through an application process and access them via a trusted research environment. So if the message here was you really need to be using these additional HES variables in your analyses for the end users of the data, that might be a difficult message to hear. And in general, we've shown that we've got a straightforward approach for missing data handling, easily implemented in standard software. And some references overlap from before, but this one, which one here, the second one, is work that we've published using just the survey data, identifying survey predictors of non-response and showing how these can be used in similar sorts of analyses to restore sample representativeness. Thanks again to the funder, and thank you.
So, any questions? People want coffee. Yeah.
Thanks. That was again a really well laid out presentation, and I really appreciate having a null finding presentation. We don't get enough of them, and it's useful to see find that. That said, I was wondering if you could comment on the null finding and whether you thought it was a reflection on the general utility of administrative data or other data sources in adjusting for non-response, given the strength of existing survey variables in longitudinal studies. And I guess a little bit more of a technical, the process you went through where you selected the variables in the HES data that were predictive of non-response. Obviously that works when you're then using just those variables to adjust for the non-response. But actually do you think the results might have been different if you'd identified variables that were more marginally predictive of non-response given the survey data that you already hold?
Yeah, no, I think that's a good question, and yeah, we did set out to do that as a kind of supplementary analysis. So, sorry, taking your second question first, to look at the kind of additional association between HES variables and non-response conditional on the previously identified survey variables. And I think that might have been, given the context that we're always going to be using these survey variables in this type of method as auxiliary variables, perhaps that's the more relevant thing to be doing. But I think that there is, separately, there's some interest in whether these HES variables are, without worrying about the survey variables, associated with subsequent non-response in the cohort. So I think it's interesting to see that. Yeah, we might have, if we'd used that other approach, we might have selected a different set of variables. But I think given the kind of the strength of associations that we see here, it's, I'm not sure how much difference it would have made. And then the broader question about the utility of administrative data in this sort of approach, I think I wouldn't want to say too much because it's, it's one administrative data set, one cohort, and one wave of non-response. I think that there's still the potential that different administrative data sources might capture much more relevant information, and it might be that it's closer to some of the information that's captured and we've already found to be useful in the survey data. So we have linkages into National Pupil Database where we would expect that a lot of the kind of academic achievement markers that are typically used would be associated with subsequent non-response. To what extent, again, that's providing additional information on top of what we've already captured in the survey, again, I'm not sure. So it might be that there's limited additional value. So I guess the situations we're looking for, where we can really leverage the additional benefit of these linked administrative data sets, is where they're giving us completely complementary information to what we've already got in the survey, and where that complementary information is expected to be useful with regards to non-response. And I don't have a feeling for quite how frequently that's going to be the case.
Okay, so I think that's time. Let's thank all our speakers again.
Thanks for organizing this session. Thanks for having me. So as Alex said, this is work that we have, the four of us who are presenting here, have jointly doing over the last year or so. My talk is kind of a little bit of an introduction, first of all, in what we mean by digital trace data. And also, I want to introduce this concept of data donation. So as I said, the four of us are working on this together, and we're very grateful for the research assistance we have received and also the funding, of course. So when we talk about digital traces, what we mean by that is that if you now, anyone who interacts with any online system leaves traces behind them. So there's different definitions out there. The second one that I really like is behavioral residue of what we do online, right? So if you go on a website, then this leaves a trace. If you use your smartphone, this leaves a trace, being it where you are or what you do with your smartphone. And more these data are used to learn something about human behavior and social interactions, for example. And the advantage of this digital trace data is that they're very fine-grained, right? Like if you compare this to surveys, they collect data at a much higher frequency than what we could ever ask for. So, and potentially this is even in the moment, so it continuously comes in. So this allows us to evaluate change over time at a very fine-grained level without really increasing the burden to participants, right? Because they have, once they have to consent, of course, to having this data collected or donate the data, as I'll show you, but we don't have to continuously ask you, what are you doing? Where are you right now, right? So this would be not possible. And it's scalable, right? If you compare this to old methods such as observation, where we had human observers, this was always contained to just like small populations. Now we can do this on a much higher scale. The other thing what's really great about this type of data collection is that the measurement happens in a non-reactive way. This is without really the solicitation of the participants. We don't have to ask, we just observe people. And for that, the digital trace data measurement should be unaffected, or the data should be unaffected by the measurement process itself. Think of social desirability, think of forgetting, and other types of things. So there's a number of studies that have shown in different contexts that this is actually then higher quality or data that has a little bit, that has less measurement error to some extent than self-reports. For example, there's a number of studies that show for smartphone use or what people do online, or how people travel, that it comes with less measurement error. There's different ways of getting access to these digital traces. One that it's been used, especially in, I would say, in communications studies, for example, is that where you ask a user to download to their computer or to their smartphone or both of them a little plugin to the web browser, and the web browser basically continuously tracks the information of where people go. So the URLs they go to, there's different technology that does that. Don't have to go into detail there. And of course, the same works on smartphones, right? Usually with an app that is downloaded to the smartphone, and then it basically tracks or taps into the logs of the usage behavior of the smartphone, so what people do, but potentially even the sensors that are built into a smartphone, GPS location and other types of things. Again, the great thing is that it allows tracking of individual behavior. So this is different from what people sometimes call big data, right, or found data, where you really don't know who are the individuals that produce this data. There we can link this back to individuals, potentially over a longer period of time. And there's actually a couple of marketing research companies out there that have started to build up this, what they call metered panels, right? So traditional online panels where people are asked survey questions, but then they install this and then can link the web survey responses to this online behavior. A more recent approach is what's now called data donation. This takes advantage of the GDPR Article 20, which stipulates the right of data protection. So any online platform that now collects data needs to give their users under GDPR the right to get access to their data. And the GDPR regulations stipulate that it has to be in a structured, commonly machine-readable format. This is then called a data download package. And the data users, so the people who produce the data, so you yourself, your own data, you can access. You need to have access. You need to be granted access to that data, and you can decide what you want to do with the data. You can share it with another platform, for example. You can look at it if you want, but you could also give it to researchers, right? And that's what we are talking about here. And 2 research groups in the Netherlands have started to build up platforms that researchers can use, basically where they ask people to download these data packages and then upload them again for research purpose, right? So there's the Port and the OSD2F platform. In our study, we're using the second one. Actually, the little depiction on the right-hand side is from Port, but the idea behind that is the same. So as a user, you go to the platform, social media platform, a couple of others. You request to download your data. You receive your data package. You store it on your own device, right? And it's at that point not stored with the researcher. And then you go to any of these platforms and upload your data again. And what these platforms do, they allow also the people who upload their data to curate the data. So to see what's actually in there, to potentially take out data points that you don't want to share with the researcher and the like. And some of those platforms, the Port platform also does some feature extracting already on that thing. So it gives you, as a user, it is much more control that you have over your own data, right? And that's what we think is also an advantage here. So it works with many platforms. And again, any organization that works under the GDPR legislation needs to comply with that. For example, what you can get there is actually detailed Facebook data that you wouldn't get otherwise, right? There's currently no way to get to this data, but it works with WhatsApp, Google, location history, Apple, Fitbit, you name it. And again, the user retains the control over the data. The downside is that this uploading, downloading process is somewhat clunky still, I would say. And also the data linkage, as I'll show you, is not perfectly implemented yet. So what we wanted to do here, this is our little research questions we have, is think about how feasible is it to implement a data donation process into one of our web surveys. How willing are people to actually share this data with us, especially Facebook data? We were interested in that. And whether there's any type of bias. Are certain people not willing to do this? And do we see bias then in the measures that we would collect? So what we did is we actually had a series a couple of waves of web surveys. What I'm presenting here is actually the last one, the fourth one. Alex and Paulina will talk about the others that came before that. But in this last web survey, it was a 5-minute web survey last December. We invited around 1,200 German Facebook users to a web survey. And at the end of the web survey, we asked them, okay, we have another little exercise for you, a little task. Would you be willing to share some of your Facebook data with us? And we described this, or there's different data packages, as you will see in a minute, that you yourself download from Facebook. So if you have a Facebook account, you can do this yourself. And we ask for 2 types of data sets. One is what's called the account information, which is basically just timestamps of when you logged into your own Facebook account. And the second one is what's called topics, and that's just a list of what Facebook thinks are the topics you like. So that's actually the data they sell to advertisers, right? Because that's what they infer from your behavior, what are your interests. And to do this, actually, do this whole process, we only allowed people to who were at that point on a PC, because that's currently right now the only way it works. So we have around 1,000 people who were there. On top of that, we implemented a little experiment, a gain-loss framing experiment. This is the way we framed this data collection process, whether it's if you're not sharing this data with us, it's less valuable for research, so there's a loss framing, or framing this in a way that's like, okay, this is really helpful and this makes the research more valuable. So out of the 959 people who responded to the survey, about 80% said at that point when we explained what we want to do, yes, I'm willing to do this. I'm willing to donate this data, which we thought was quite a high number. We looked at and we found that men, younger respondents, and those who indicated higher trust in researchers were more willing to donate. So I think this makes sense. And we didn't find any difference in general trust measures, trust towards Facebook, general privacy concerns, how frequently people say they use Facebook, age, education, and also again loss framing didn't really change anything. Then comes the tricky part, because we had to walk people through this kind of like downloading, uploading, and I'll show you, I think, 18 slides or so and this is also how we had to tell them what to do. We go to facebook.com/DYI, download your information, and you can do this if you want. Basically, you have to set the date. We ask for the past 3 months. We ask them to specify the data format, so you can either choose JSON or another file format. We used JSON. There's a whole list of things that you can ask for. We ask for the account and topics data package. You create then a data package. You download a zip file. You have to find the zip file on your computer. You have to unzip the file. You have to rename the file, because that's the way to link back this file that you're later uploading to the survey data. You have to do this for both of them. And then you go to the OSDF platform and upload the file, click consent, do this with the second file, click consent again, right? So I know, it's quite a thing to do. In the end, we received around 700 individual data packages, data donation packages, right? So this is what we found at the end. So those are separate things, the web survey and then the data donation, right? So we identified 684 individual data donation packages. We were able to link these data packages back to the survey respondents for 363 individuals. So 363 individuals had at least one data package that we found. This is about 47% of the people who said they were willing. We had to do some matching, so the matching was not perfect because some people didn't put the right ID in there, so we had to do some matching based on ID and timestamps, so when were people in the survey and when were they on the platform to upload the data. And then again, we looked at what is the process of who we're losing in this process. And we find that, again, people with higher trust in researchers who are more likely to share the data. And surprisingly, those who say they have lower trust in Facebook and higher privacy concerns. And I puzzled a lot about this finding, but maybe I'm rationalizing this now, but maybe it makes sense. People who are at least suspicious about Facebook thought, wow, this is a cool thing to do, to see actually what data Facebook has about me, right? So that's how I think about this. And again, no effect for gender, frequency of Facebook use. So this is what we think if you would want to measure Facebook frequency of Facebook use with that data, that would be no bias in there. So to wrap up, while we had 80% of the web survey respondents indicated that they were willing to donate the data, only a little over 1/3 actually donated this. However, the reason for not donating seems to be related really to the technical process of going through that. Our colleagues in the Netherlands are working on making this implementation easier, especially this linking process was really a pain, I have to say, right? And we lost probably a lot of people through the linking. We see that there's differences in social demographics between donors and non-donors, but there doesn't seem to be bias, at least not in the measures that we are interested in the sense of like how frequently someone goes on Facebook, for example, right? If that's what you want to measure here. This donated data, we still think is very interesting, both for methodological questions, as Paulina will show you later, but also for substantive questions on online media consumption, especially what people do within Facebook, because there's no other way to see this. Okay, thank you.
Okay, thank you so much. So we have a few minutes for Q&A, and also for those that are online, you can put the questions in the chat, and I'll actually try to check it this time. So any questions from the room? Yeah, and could you take the mic from Ruben, please, so our colleagues can hear online?
My name is Arnoud from Statistics Netherlands, so Laura's colleague. I was triggered by a remark that the data collection is unaffected. You said that that's a big advantage, and I really like thinking about measurement errors and stuff like that. So, but I understand that you collect the data afterwards, so they have done their behavior, and then but still they can say some of the data you shouldn't see, huh? Can you do any analysis? Can you see whether some data are deleted or not, or you have no clue?
Yeah, we don't know. That's a very good point, right? So, as you said, the advantage is that this is retrospective data, right? So we asked them after the fact, so we think there is no reactivity there. What we don't know, and I think also what we, from a GDPR and legal perspective and ethical perspective, is we wouldn't even want to know what people delete at that point, right? And whether, to be honest, my hypothesis is that hardly anyone deletes anything. It's just the knowledge that you have the chance to delete stuff creates this notion that you have more control, right? That's an untested hypothesis, but that's how I think about this, right? I give you the chance, I show you actually the data there's nothing dangerous in there, okay, I'm giving this away, right? I think this is very different from just like, oh, we're collecting all this data, but we don't show you something. But I agree with you, we need to better understand whether people are deleting something. Yeah.
It might then be another effect, that it's the selectivity. People think, oh, these websites, it's not so good that they see this. no, I'm not going to donate. So it might be a possibility. I don't know, of course, I haven't studied, but I can imagine.
Yeah.
You have it then in selectivity, maybe.
Yeah, and I mean, we're just starting this research, and also I think the people at Utrecht are really diving much deeper into this right now to better understand and to make the process of donating the data easier for participants, right, which I think is still very cumbersome, but also better understanding, like, what are the mechanisms that go on when people are donating this data.
Thanks.
Thank you.
Other questions? Paulina, did you have something? Could you take the mic? Yeah.
I think one thing we could do at least is just to look at the amount of time it took people to upload it. And I think we have looked a little bit because we also used it to actually link some individuals. And in most cases, that's also why we're suspecting that people didn't really look through everything and deleted things consciously, because from the moment that they were redirected from the survey, the moment they uploaded, it was like 1-2 minutes, right? It was a very short period of time. So then we have reason to suspect that actually they haven't really gone through it, because it's a very long day. Of course, we asked for a couple of months or so of logging details, so then going through each kind of row in that data set would take a while, and it doesn't seem that in our sample anyone has done it. They almost immediately uploaded it.
Excellent. Thank you so much. So I think that's it for Florian. You're off the hook. So up next we have Ruben Bach from University of Mannheim, who will talk about this data from a different perspective.
Yeah, thank you very much, Alex.
Thanks.
Perfect, thank you. So this is joint work with Christoph Kern, who is no longer at the University of Mannheim, but at the University of Munich in Germany. And we are more focused on the question of how can we derive measurements when we have novel data sources, when we have big data sources that we can use for the typical social science, I'm a social scientist, type of explanatory regression modeling, for example. And the background here is that digital data from novel data sources, big data, textual data, social media data, sensor data, and whatnot are becoming more popular in the social sciences, but also in many other disciplines. And they require a lot of preparation, a lot of cleaning, a lot of modeling decisions, a lot of decisions along the typical pipelines that we develop when we use methods that were rooted in computer science or in general in the data science toolbox. And we kind of want to focus on some of these modeling decisions and show how we can implement a typical approach that is focused on regression type, social scientific, explanatory modeling with data from novel data sources, with big data. And we also want to highlight that we need more research to understand how different decisions can have very different impact on the results that we get. And as an example, we will focus here on news media consumption. Here are just some examples that have used digital trace data in recent years. So there's clearly a high interest in doing research with this kind of data on all kinds of topics. So related to consuming information about health on the web, most prominently featured with the vaccination and COVID situation, but also in political communication that's very popular, like who reads what on the web with which effects on their political preferences, for example. And just a few examples to summarize their questions. So far, what we have seen is people have used web tracking data, so where individuals download a tool into their browsers or a research app onto their smartphones that tracks what people do online, like the websites they visit and the apps they open. And what people have done so far is mostly try to understand what are the determinants of using or being exposed to certain kinds of information, like who visits anti-vaxxer websites in the US or fake news websites in the US, in Germany, who searches for what health content, and does social network use increase news consumption, for example. Their goal usually is to reduce news media diets to a few informative variables, or understand who visits these websites, and they just group them together and then translate it into this, as I already mentioned, regression type modeling. What those studies haven't done so far is dig a little deeper, and that is look also at the content of what is consumed. So we've seen like who is exposed to health information on the web or misinformation on the web, but now we could say, well, we also want to understand what is the actual content that people get in touch with. So if we look at misinformation, there can be anything from just, say, populist narratives to completely made up false content. And this certainly makes a huge difference for people's opinions, attitudes, and say trust in democracy or the media system. And only a few studies have used the full potentials of these data to understand what are the contents of the articles consumed. They scrape the contents of news articles and then use some tools, some NLP tools to arrive at measures of the actual content that is consumed. And so the brief example that I want to present today is we use data from about 3,000 participants recruited in France, Germany, and the UK during the run-up to the last EU Parliament election in 2019, when the UK was still part of the European Union. And among those people where we observed their online behavior and specifically which kind of news information they consumed on the web, we also fielded 2 survey rounds where we asked them about their political preferences, their political interests, their voting intentions, and in the second round of the survey, after the actual election, how they voted in the election and whether they voted at all. And now what we want to do as a little empirical exercise, we reduce news media consumption to a few informative variables that we then link to political preferences and voting behavior as reported in the survey. And we only use information on news media consumption prior to the election, and then survey data collected after the election. And so our pipeline here is, and as I mentioned in the beginning, we could have chosen a completely different pipeline, but just to show you how many steps we need to take and where we could also decide differently. First step is we need to decide what is the content that we actually want to focus on. And here we focused on articles read on the 100 most popular news outlets across all countries. Then we scrape the title and tags of each news article, so we focus on the headlines only. We do not go into the actual body or the actual news article itself, just on the headlines, but going more deeply into the content of the actual news articles would be a next step. Then we process them, French, German, and English, well, 3 different languages. So what we did was we automatically translated everything to English, and then used transformer-based NLP algorithm to come up with numerical representations of the words that are present in the titles and tags. And then we use those numerical features to describe and predict political preferences. And we use a method that was introduced in 2018 and is now very popular, and probably many of you have at least heard of it, BERT, a pre-trained language model based on word embeddings, contextual word embeddings, and we fine-tuned it for classifying articles into topics. And since we already, we also scraped the tags associated with the headlines of the news articles, we already have our labels. So if an article read, say, the Bank of England has changed interest rates by X% or something like that, it would be associated with like economy, UK, and finance or something like that. And we can use those tags for fine-tuning our language model. And then we average word encodings for each article title and reduce it to 50-dimensional encodings. But then we still need to reduce it. So for every article, we have 50 variables that describe its content in numerical representation, and that is still too much information if we just want to explain political preferences. So we took 2 steps. One is k-means clustering of news articles, so based on these 50-dimensional encodings, and using typical criterions for selecting the optimal number of clusters. We came up with 2 times 26 clusters. And then we aggregate on the respondent level the number of articles read per cluster and the time spent in that cluster. And the second approach is a principal component analysis of the BERT encodings with the goal of reducing this 50-dimensional encodings even further to just a few very informative dimensions. And we get 3 times 6 components, 3 because we compute on a respondent level the mean, median, and variance for each of these PCA dimensions. And in a way that is another approach, and you can already see both approaches are probably valid, good, nice ideas how to deal with this kind of data, but they will probably give us very different results. Model architecture, I won't go into details, but this is just if you're familiar with this, with these models, this is a typical setup. And then to show you some results, this is for one of the PCA components that we identified as entertainment versus German election news. And as you can see, when we look at the most extreme component scores, on the one hand, we have those articles that clearly focus on entertainment, like Game of Thrones and some movie stars. And on the other hand, we have European elections, some voting advice. Wahlomat is a voting advice application. And so we clearly see that this model does a very good job in understanding the content of these articles. And then what we did was we had our little empirical demonstration where we want to focus on explaining, I think it's, predicting political interest. We also predicted like voting intentions and actual vote choice using these political news consumption variables in a typical regression framework. And what we see here is they do have an impact on political interest, even when we control for typical social demographic information like age, gender, education, and income. So there's definitely some, we could make sense of the content of news consumption, and we could summarize heterogeneity in news consumption. But this is just driven by very everyday theorizing about potential relationship between news consumption and political interest. For discussion, we've presented an approach or two approaches how we can break down information that we obtained from novel data sources, from novel data, from big data that is very popular in the social sciences. We could break it down into just a few very informative variables that describe respondents' news diets and heterogeneity in terms of topics. And we could then use that information to explain their political preferences, such as political interest. However, and this is what I want to emphasize, there are so many modeling decisions that we have taken across our modeling pipeline. Like when we go back here, we could have also focused on the 200 most popular news outlets. If you think of regional news, then there are probably just very few people who read regional news, because if we have, say, about 1,000 respondents per country, then what are the odds that you have more than just 2 or 3 who read a newspaper that is very regional? And it may, however, be very important because it presents different kind of news. Scraping, we focused on titles and tags. We could have also focused on the whole content of the articles. We translated everything to English. There's certainly some error coming from the automated translation. We could have used another embeddings model. And so I just want to highlight, here we use 2 different approaches. Both kind of make sense, and if we put them in a paper, probably reviewers would say, yeah, this is kind of okay. But we don't know how these decisions affect then the results that we get at the end and our substantive findings and interpretations. And so when we're dealing with this kind of data, there are so many decisions that we need to make, and a lot of different decisions are all well justified. But the question is, do we arrive at the end at similar conclusions? And for future research, we should definitely dig a little bit deeper. That is what we're doing right now, more from an applied political communications perspective. And also look at, for example, stance of articles. So identify, say, politicians that are mentioned in an article, and then whether the article is positive or negative towards those politicians. And with that, I'd like to close. There's a paper where you can read up some of the methodology. That's it from my side. Thank you very much.
Okay, thank you so much. So any questions? Yeah, we have a question there, Paulina. Yeah.
Hi, I'm Alicia Davis. I was just, I might have missed it, but I was interested in understanding the digital trace data, but how that then translates into whether people act on that or not. So did you look at their vote, not just what they were looking at, but how their voting intentions or what they...
Do you mean whether, I didn't get that.
So when you're looking at political news media, or this example,
Yes.
what people are looking at, how that influences behavior?
Yeah, I mean, that's like the part of the question that we didn't really focus on in this project because it was more focused on the methodology. But I'm also like, I do a lot of political communication research, and that's where we're exactly focusing on that question. And just like an example, we're currently, because we have a longitudinal structure, what we're currently doing is we created variables that measure exposure prior to each survey wave, and then we want to explore more the causal chain of how exposure to certain types of news media influences, say, trust in media or trust in democratic systems. But I can already tell you in the short time span that we're looking at, which is not from the 2019 data, but 2021 data, there are no effects at all. I guess that's one of the Han-Ag kind of questions, like this. News media consumption influence political preferences, or the other way around, or maybe like both ways, and figuring that out is still up for debate in a lot of research.
Thank you. So other questions? Yeah.
I would still be interested, how selective was now the group that donated their data?
Yes.
Did you try to estimate it?
That's a very good question. In the paper, there's about like one page where we discuss error sources of representation and sample bias and the like, but this was really focused on like the measurement side. There's one or multiple researchers, but Melanie Revilla in Barcelona, I think, and Oriol Bosch at LSE, they are looking at exactly these kind of things, like selectivity of the samples. We're doing now a lot of research on does, for example, being observed change your behavior? So, for example, Florian, Alex, and I recently had a paper where we wanted to understand whether knowing that you're being observed changes consumption of sensitive content. Other questions more focused on the methodological and representation side, but this is just focusing on measurement, and I refer you to those other sources for more details.
Okay, thanks. Yeah.
Thank you. I think that's it. Thank you so much. Florian, can you keep my time? Yeah. So I'll be up next. And I have a very annoying cough, so if I lose my voice or have a cough fit, I apologize in advance. Okay, so I'm going to continue discussing the data that actually Florian presented. So we're going to look at digital trace data, and I'm going to talk a little bit more about the design we had. And again, I'm going to concentrate on the measurement. And the questions we want to answer are basically, what is the best way to collect information about media consumption, especially if we're thinking about phones or PC or online media consumption. And again, this is a very interesting question for political sciences or media sciences and so on. And can we improve current practices? So in the literature so far, people tend to prefer either the survey or the digital trace data, but there's very limited research comparing the two and trying to figure out, okay, which one is the best, and even if we can combine them to get better estimates. And Florian talked a little bit about advantages and disadvantages of surveys versus digital trace data. So with surveys, ideally, you could have a probability sample. You can decide how to do the design. So, what questions to ask, what period, what response scale. You have long-term comparability. So, you can compare questions over a long period of time. You don't have to be afraid that, the app that you use to collect digital trace data doesn't work anymore. But of course, there are other issues. So normally it's discrete information, so it's not really continuous longitudinal data. We can't really ask people to tell us, every minute, every hour what media they consume. It's high burden, so if we ask people to give us information to remember, how much time they spend on reading the news yesterday, it's hard for them to remember, and of course, they might not remember correctly. On the other hand, digital trace data in principle is low burden, so if they install one of these trackers, it's very easy then to collect data without them doing anything else. You could argue that there's low reactivity, so once they install it, they kind of get used to it, and you'd think that they don't really change their behavior. And it's very high frequency, so we can know literally every second what they're doing. Yeah? Then the disadvantage, typically this digital trace data is used on smaller sample sizes and typically very selective sample sizes. It really depends on technology. So, if the Android updates and then an app doesn't work anymore, you might not be able to compare the digital trace data of this year with the one from last year. And even if people say, well, this, it doesn't have any measurement error, that's not really true because it has just other types of measurement error. So multiple people can use the same device, multiple people have multiple devices, people can turn off tracking, and so on, right? So there are different ways in which you can have other types of measurement error. So I'll talk a little bit about, about the data that we used. Florian already talked about part of that data. So what we had was a survey with 3 waves initially, with around 2 weeks between them. And then this was from a non-probability panel from Germany, collected by Responding. And then we had digital trace data from the phone, and we had 2 types. We knew all the apps they were using and the period for which they used it. We didn't know what they did inside, but we just knew that they used different types of apps. And the same for the main browser of the phone. So we knew the websites they were visiting on that browser. Okay, so we had this starting from before the survey and until after the survey. So this is really continuous data collection from. We also had digital trace data from the computer. So on the computer, they installed an extension that followed the websites. So we knew what websites they were visiting, again, on one device on their main browser. So again, that could have some measurement error. And then we had the, the data donation experiment. So this is what Florian discussed. At the end of the data collection, we had the small survey, and we asked people to donate data. So that's this, the blue part here at the end. And for the people that donate data, we had, again, continuous data for this entire period. In addition, so one thing that we're interested in was that we don't really want to assume either the survey or the digital trace data is perfect. So we want to have a way to estimate data quality in the survey. And what we did is we had another wave here between wave 1 and 2, where we did the MTMM experiment. So we had the same questions that were in first wave. We asked them in a slightly different way 1 week later. And that way, we had a within experimental design, and we could estimate something called a multi-tray approach to estimate quality in the survey. Then we could compare that with the data quality from the apps. Yeah? And the data I'm going to discuss here is basically data from here. So we have the first survey, we have the MTMM data, so this will be our survey information, and we can estimate already data quality here because of the within experimental design. And then we had the data from the phone. Okay, so and the data was either from the websites they visited or the apps they used. And the topics the topics we're interested in were how they use their phone, okay? So we wanted to know how often they use their phone to make calls, to write text messages, take photos for social media and web browsing. And again, these are interesting questions for political scientists and for people interested in media studies and so on. And we had 5 different ways to measure this. 3 of them were from the survey and 2 of them were from the digital trace data. From the survey, we had what we call 3 methods, 3 different ways to ask people. So we had the 5-point scale. So we asked, okay, how often do you, use the phone to make calls, and this was a 5-point scale, right? And the scales are not great, but this is what people are currently using. These are, from the European Social Survey, European Value Study, from high-quality surveys. These are the kind of scales they use to measure this kind of concepts, which are probably not great, but this is the current practice. Another way to ask people is to use a 7-point scale. And then we also asked them with duration. So there were 2 questions saying, okay, how many hours and how many minutes do you spend doing these different activities? Okay, so these are from the survey, and from the digital trace data, we ask either we looked at how many times they did the activity or how much time they spent on it. So again, it would be number of time, duration. Here we combine the apps and the web browsing information to do the digital trace data. And for the survey, the way it worked is that we randomly allocated people in the first wave to 3 groups, and each group would get the questions using one of the methods. And then in the next wave, we asked them the same questions, but using a different method. Yeah, so we randomized the method they received. That's why we have 2 measures from each individual with 2 different methods, and we can separate different sources of variation. Yeah, so we can estimate measurement error. And the way we do it is the model called the multi-trade, multi-method approach, which is a pretty well-known method in psychology and sociology and survey methodology. And the idea is that you have multiple measures that measure the same concept using different methods. Yeah, so the concepts were the 5 that I mentioned, how many calls they do, how much they go on social media with their phone, and the methods are the 5 methods I presented before. So 3 from the surveys and 2 from the digital trace data. The way this model works, and some of you might prefer formulas. Unfortunately, I just put the same drawing here. The way this works is that the squares represent variables that are in the data. So for example, this could be the first variable, like the number of calls, and the first method could be, for example, the 5-point scale. And then we could have the 5-point scale for the social media use, the 5-point scale for another trait or topic. Yeah, so then for the method, this latent variable, this circle, measures the effect of using a 5-point scale versus the other methods. And then these other latent variables on the bottom, these are the true variable that we're interested in this case, the 5 topics. Yeah? Before I go to the results, I'm just going to show you some correlation matrices. And so here we have the call. So this is how many calls did you give with a 5-point scale, 7-point scale, and duration. All of these are from the survey. So this square here, in principle, are 3 different ways from the survey that should measure the same thing. The only difference is just the scale you use. See, there's a pretty high correlation, but it's not perfect. And we see that the 5 and 7-point scale are a little higher, have higher correlation to each other than the duration one. And again, makes sense because they're more similar scales. So you see kind of, there are squares here in the sense that, okay, they clearly kind of measure the same concepts, but it's not as big the correlation as you would expect. If we look at the digital trace data, correlation between counts and duration, so we see that they measure the same thing, the 2 of them. Put them together, things don't look very good, very well. So here we have the square on the top left. These all should measure how much the people use their phone for calls. The first 3 are the survey. The next 2 are the digital trace data. And you see, basically, we have 2 different clusters. So it appears that the survey and the digital trace data basically measure almost something else. The correlation between them, again, it should be food for thought. We should start thinking, okay, are the concepts different? How big are these measurement errors that correlations are 0? Okay? So based on this, so this is the correlation matrix. What we do next is we do this MTMM model. And with the MTMM model, what you can do is you can decompose variation in 3 sources. You can have the trait or the thing that you actually want to measure. Then you have a method variance, and this is we would call systematic variance, and this is the variance that is related to the method. So the fact that you use a 5-point scale or that you use a digital trace. And then you have random error that isn't correlated with anything but doesn't measure what you want. Yeah. So we can aggregate this in different ways. So this is the decomposition by method. Yeah? So if we look, this is the data quality for the 5-point scale, 7-point duration from the survey, count from digital trace data, count for duration from digital trace data. And ideally, what we want to see is this trait to be the full thing. Yeah? We assume that there's no measurement error. Most social scientists assume that. But we see there's a lot of measurement error. So we see that only 25% at the 5-point scale measures what we think they measure. Okay? So even if it's not 25, it's 35, it will still be, we should be concerned that these questions don't seem to measure what we want. We see some methods are better than others. So for example, here, based on this model, it would appear that the digital trace data is better, but it's not perfect. And also we see there's a lot of random error, but there's some systematic error, and this tends to be bigger on the survey than with the digital trace data. We can look at this in a slightly different way and say, okay, out of these topics that we're interested in, are there some that are easier to measure and some that are harder to measure? And again, we see that, for example, social media and web browsing are slightly easier to measure, but calls, messaging, and photos are harder to measure. And again, here you could argue, well, maybe the digital trace data, we could use it as a gold standard, and we should assume that what's in the survey is wrong. But again, this model does not assume any of them are gold standard. They just assume, okay, all of them have measurement error, and it looks at the consistency between them. And then what you can do with this model is actually look at the combinations between methods and topics. So you can see, okay, are there questions that are better to be measured in a particular method or not? Okay. And here, for example, we see that like before, the social media and web browsing are easier to measure. Messaging, for example, is really bad for digital trace data, and we haven't really figured out why that is yet. And in general, yeah, so for example, using surveys to measure how often they call people is very poor quality. Yeah. And the nice thing about this model is actually you can use it for correction. So you can use the trait and do multiple imputation or directly in this model and do models with that. So it's an advantage because actually you can correct for some of this bias. So conclusions. So digital trace data seems to be more precise and surveys, but this is far from perfect. And I would also mention that what we looked at was variance decomposition. We didn't look at mean bias, and Paulina will talk a little more about that. But this is an aspect that is also important in the sense that is the average higher or lower in one of the methods, and is that systematic? And we can't really see that in that variance decomposition. So that's something to keep in mind. But like I said, Paulina will talk a little more about that. It's not really clear why trace data is so bad in measuring text messaging. And again, we it was mentioned before, actually we need to make lots of decisions to code all these apps and all the websites in order to define what's social media and what's messaging and so on. So we could have done some errors there. So that's possible. So there are lots of decisions that could impact that. And then one interesting area, next step would be to see how if we look at substantive research from political science or media consumption, would we get different conclusions? And if we combine this, or if we correct for measurement error, would we have conclusions? Yeah? So I think that's really important to show applied researchers, okay, they should care about this, and to highlight, that maybe having experiments, having multiple measures is a way to correct for bias. So that's it. Thank you. Any questions? Yeah?
Thank you. Thank you very much for a well-presented paper. Please, can you take the slides to where you have the 5-7 Likert scale?
the scale, sorry. So here?
Yes.
Yeah.
More often when I'm to fill a survey, take a survey, I'm always confused when a response of this nature comes up. And when you ask how many times do you watch television in a week, you say less than once in a week. I don't understand that. How can one watch the television less than once?
Yeah, so if you look at the distributions, actually, these are really bad scales because these distributions are quite skewed, right? These were developed long ago. These are kind of classical survey scales, and unfortunately, they're still used. We had a lot of debate about if we should actually use these scales because most people, how often do you do web browsing? I'm not sure who will say once or a month or less. They either do it or don't do it, and if they do it, probably it's more often than that. So I would agree with you. These are not great scales, and probably if we would do them, we would do them in a different way. We just decided to use this because this is basically the current practice in big surveys. Yeah. But I agree, they're far from perfect. Other questions? Yeah.
Really like those methods, multi-trait. I'm quite sure they have certain assumptions, and you need to fulfill the assumptions for the outcomes to be well. Did you have a look at it? Because you have such a low variance of your traits.
Yeah.
Could it have to do with the assumptions, that some of the assumptions failed a little bit, so you underestimated?
Yeah. And we did, so for example, with the distributions, we did have to, so for the digital trace data, we did have to take the log and so on. And the survey questions, I think in the end, we use them as they are, but again, we could think of transforming them. The other thing is that we also have missing data. So another idea was to do like a latent class NTMM where we just have if people do the activity or not, because there are some people that either have missing digital trace data, and if they have that, it's either they don't do the activity or they turn off the tracking. And then there's some people that also say they don't do the activity in the survey. So we're thinking maybe to do some sensitivity analysis where we check the distributions, where we just look at the dichotomous variable. And Paulina did a little bit of that because she used latent class and a different type of model to look at data quality. So she'll discuss that. But yeah, I agree. I mean, another problem with this model is it's based on this correlation matrix, right? So this fact that you have this that are not correlated at all with others, it's already a sign that they measure different things, right? So it's, in a sense, you get what you expect, but for some of this, you could assume that one is better than another. So you could fix and say, okay, maybe for calling, digital trace data should be perfect because in principle, it should measure every time people call someone. And then you could look at measurement error compared to that relative. So you could use one of the methods as the reference. So that's another way to do it. I mean, we try to do this in order not to make this assumption, right? Because a lot of people assume, oh, this is perfect, and let's go on. So we wanted to move away from that. But it is problematic, I think, that there's almost zero correlations for in survey data, I haven't seen that. In principle, there should be a correlation there. So that might be problematic. And again, I think the model that Paulina uses makes fewer assumptions in that sense. Okay, so I think I talked enough. So up next, we have Paulina from now University of Utrecht. Thank you.
This is the last of our series of papers with everyone here at the table. co-authoring this paper. And in this paper, we specifically looked at measuring Facebook use, and we compared the accuracy of self-reported data and digital trace data. So first I'll talk a little bit about how Facebook use is measured and how the quality of those measurements is assessed. And then I'll talk about our own research where I mentioned we examined the quality of those two data sources, so the measurements coming from those two data sources. We have a longitudinal survey and tracking apps and Facebook donated data. It's exactly the same data that Florian and Alex already described, so I'll skip that part. But first, how is Facebook use normally measured? Where it's measured across various disciplines. It's quite interesting for researchers in communication science, in political science, but also in psychology to look at, for instance, how Facebook use affects mental well-being. So it's extensively studied and researched across various disciplines. Up until quite recently, most studies relied on self-reported, so survey measures of Facebook use, but of course those contain measurement error. As we all know, we have inadequate questionnaire design, incorrect data collection processes. We have also interviewer and respondent effects. And what's happened even more recently is that due to the availability of digital trace data, researchers have started assessing the quality of these self-reported measures. However, it's often relying on the very unrealistic assumption that digital trace data are error-free. And as we all know, there's no such thing as error-free data source. So in this case, we can have incomplete data if we, for instance, have tracking devices or tracking apps only installed on someone's computer or only mobile phone, or maybe they have multiple mobile phones and we're only tracking one of them. Also, sometimes respondents or individuals switch off the tracking app to save battery, save space, and so on. And that brings me to our research aim. So we are examining the quality of self-reported Facebook use and digital trace data on Facebook use simultaneously. We assess the nature and the incidence of the error, and then we compare it also for those two sources. Skip that part. We have the exact, so we use the same data that was already described before. We have data from Germany and the survey with the free waves and the tracking up. And eventually, we're also using the Facebook donated data for our subsample. It's about 15% of individuals. So a little bit about the Facebook use indicators that was also mentioned a bit. From the survey, we have a 5-point Likert scale. We're asking at the frequency of use, the once a month, several times a month, several times a week, daily, and several times a day. And the tracking app, of course, we have much richer data. But what we did for the purpose of this paper specifically is we harmonized the tracking data so it fits the survey question. So what we did is we looked at free 10-day periods. So we looked at the day that an individual filled in the survey and 9 days beforehand. And then that was our period that corresponds to wave 1 in the survey. Then we did the same for wave 2 and for wave 3. The reason we chose 10-day periods is because then we don't have overlap. So as Alex mentioned, the survey waves took place every 2 weeks. And so if we have 10-day periods, they don't overlap with each other. Then we looked at how many times Facebook was used on either device that's tracked by the individual at least once. And then we summed those days for each period. So we have, for instance, 5 days out of 10 that an individual uses Facebook, or 7 days, and so on. And then we categorized this continuous usage variable, so it corresponds to those 5 categories. Of course, here we chose thresholds a little bit at random, I would say, but we're also going to run sensitivity analysis where we see if we choose the threshold a bit differently as to which number of days corresponds to which category, and see whether that affects the results of our analysis. We use hidden Markov models. For those of you who are not familiar with HMMs, they're a group of latent class models that are often used to estimate and correct for measurement error, specifically in categorical longitudinal data. The attractive part about them is that they do not require any of the data sources to be error-free. Instead, they use the availability of repeated measures and they extract the information about the error from the data itself. Normally, the standard hidden Markov model has at least 3 repeated measures of one indicator, but we can also use extensions of HMM. So for instance, multiple indicators, HMM, what we also use in this paper, and then we correct for error in all sources simultaneously and obtain one set of error-corrected estimates, consistent error-corrected estimates. So the standard HMM relies on two assumptions very quickly. The Markov assumption, so we assume that the true, in our case, Facebook use at time t only depends on the true Facebook use at time t minus 1. So it's an autoregressive process of order 1. And then we have the local independence assumption that we say that our observed Facebook use, for instance, in the survey, only depends on the true Facebook use in the same time point. And so that's quite a problematic assumption, because basically what we're saying here is that we have Facebook use that we observe in the survey that contains some error, but it's only dependent on the true Facebook use. So that means that, or that implies that our error is random. But luckily, if we use multiple indicator HMMs, we can relax this assumption, which is exactly what we did, and we can then also model systematic error. So that's our model, the one we use for our analysis. So we see here that we have the Facebook use, the true Facebook use, and then we can observe it in the survey for 3 time points and in the tracking app data also for the same 3 time points. We relax the local independence assumption. So for the survey, we assumed that the error also depends on the wave. So we assume that individuals might, over time, understand the questions better, learn a bit, and so answer more correctly. Or on the other hand, they could also, due to fatigue, for instance, actually answer that, pay less attention and actually answer with error more often. Then we also saw from previous research that error in social media use is dependent on age and gender, so we also included that. And for the tracking app, we know also from previous research that one of the biggest predictors of the error is the number of tracked devices, and specifically whether we're tracking mobile phones only, computers only, or both. And finally, in order to make this model a bit more realistic, we also assumed that true Facebook use depends on age, on migration status, education, gender, and also the number of devices that we can actually use Facebook on. We only assume that for the first time point because the transitions between time points with a lag of 2 weeks shouldn't be affected by many characteristics. And those are our results. So we fit models with a different number of classes, varying from 1 to 8, and from BIC fit statistics, we saw that a model with 3 or 4 classes fits the data best. Here I present a model with 3 classes. And then what we can see if we focus first on class 2 and 3 is actually that both frequent users, so that's in class 2, are measured quite accurately in both the survey and the tracking app. So whether if people use Facebook several times a day or daily, they are measured quite accurately in both sources. And then for the third class, we see that infrequent or highly infrequent users are also quite well measured by both sources. But then we have class number 1, that according to the survey, they used Facebook daily or multiple times a day. According to our tracking apps, barely ever use Facebook. So it's a highly inconsistent class that contains more than 1/3 of individuals in our sample. So then what we did is we tried to dig a little bit deeper and see what actually is happening there. So then from the covariates, we see that the number of devices tracked is a significant predictor of Facebook use. So overall, if we have both devices tracked, we have a much higher probability of being a frequent Facebook user according to the digital trace data. And also, it's even more important, the probability of being in class 1, so being an infrequent user according to the digital trace data, is much higher if only the computer or the laptop of an individual is tracked. So for individuals that don't, they didn't install the tracking app on their mobile phones, they're very likely to be in that first inconsistent class. So then we see already some sort of an indication of a systematic error here when we don't track all devices, and most importantly, when we don't track the mobile phone, we seem to have a severe underestimation of Facebook use. But, well, this is just with the conclusion, we are not certain about that yet. So we actually have some sort of an indication or a theory that this is what's causing these inconsistencies. So just to conclude, we have certain groups of people, frequent and infrequent users, for which both sources measure their Facebook usage fairly accurately. But then for about 38% of individuals in our sample, we have extreme inconsistencies between the two data sources. And if our hypothesis is correct, which we'll test next, I will talk about in a second, it seems that digital trace data can reduce some sort of errors, or recall bias or social desirability bias, but actually it can also introduce new type of systematic error, which we can say it's some form of missingness that severely underestimates Facebook usage. So just finally, in terms of the next steps, so of course what we want to do now is to test this hypothesis that we've developed, and we are going to do that by adding the Facebook donated data. So even though it's only for a subsample, it's of course not a perfect error-free data source, we do expect that this data is of superior quality to the two other data sources we used so far, and we want to look at the distribution of Facebook usage according to the donated data for each of the free classes. So then we want to see whether indeed the first class, according to the donated data, are frequent users, but they are infrequent in the tracking data app due to what we expect, so the fact that we're not tracking them on all the devices. And overall, because we expect that this is somewhat of a superior data in terms of source, in terms of quality, we also, it's going to help us to assess a little bit better whether and when self-reported Facebook use versus tracked digital trace data is superior and better to use in terms of actual substantive research. So when do we actually trust the survey data, and when do we trust the digital trace data more? And we're also looking at potentially adding additional predictions of both Facebook use and the measurements of Facebook use to make our model slightly more reflective of reality. That's it, thank you very much. And then just quickly acknowledging also the funding of this project and also the people who assisted. I think Florian mentioned that already. Thank you.
Good, so any questions? Can you say a little bit about the selection? So you want to use the data donation as a validation gold standard, but we also saw response rates are 15%. So how will you deal with that?
Yeah, that's actually one of the reasons we don't include it as a third indicator in the model, because it's such a small subsample of the entire sample. But yeah, we hope to see at least still a distribution over the free classes, so it can give us a bit of an indication. If there's still a somewhat sizable group per each class, we can still say a little bit about how it compares to the other sources. But indeed, it's not really possible to use it as a third indicator, given that it's such a small sample.
Other questions? No?
Yeah. But why is migration status one of the variables that predicts Facebook use?
Yeah, it seems that actually, at least we tried with some different demographics. We tried with different demographics that were included in the survey originally, and it's specifically whether someone is born in Germany or foreign born is a predictor of Facebook use. Maybe, I don't know, Germans tend to move to Instagram more, and some other countries still remained on Facebook more, or some other nationalities, but it does seem, at least we see that foreign-born nationals are more frequently Facebook users than German-born.
Florian, there's another question.
Thank you for your presentation. Looking at it from the perspective of securing your data, how can we guarantee that you're not taking too much of the information from the users?
Yeah, at the moment, I think that was especially something that we looked into when designing the Facebook data donation experiment, but we are not taking a lot of information, so we're just looking, what also Florian mentioned, at how often people are active on Facebook, so when they have active sessions and those topics. So actually we're not really looking at any specific things, but I do have colleagues in Amsterdam, the university, that really had to design an experiment where they were also looking at comments, and that was a very complicated setup where they had to have an algorithm that removes all names and then manually checked all names and tags of other Facebook accounts and so. So I do know that when dealing with donated data, it's quite difficult to assure still privacy and confidentiality. And even though the tool we use has some basic integrated settings where some things are already removed, like the IP address is removed, so the location is not disclosed, especially when using content, so posts or comments on posts and so on, it's very difficult. It has to be done largely manually to assure that the data is still in accordance with all privacy measures.
Okay, so any final questions? Before we wrap up? Okay, if not, you can go for tea earlier. So thank you to all our speakers, and thank you for being here, and enjoy the rest of the conference.